Okay, Assalamu alaikum. This is Dr. Fehmina Arif. I'm working as a professor of pediatrics at D.U.H.S Medical College, and as part of the E-Doctor program for family medicine, I'm going to answer some of the questions which have been put up with regard to my talk on neonatal assessment and common problems. Okay, so we'll take the first question, that is highlight a few metabolic disorders that cause death in the early postnatal life. Well, there are quite a few metabolic disorders, and but the common one would be like urea cycle disorders and other aminoacidopathies, organic acidemias, which can, if not recognized or not treated, can result in death. Important thing to remember is that most of the time we do not think of these metabolic disorders because they present like sepsis, or sometimes they present with encephalopathy, and we sort of diagnose them for birth asphyxia. So the important thing to remember is that if we screen for sepsis and we find that there are no diagnostic markers which make the sepsis a likely cause, one should start considering metabolic disorders. These children can present in different ways, like with seizure disorders, with seizures, or with lethargy or reluctance to feed. So they may present just like a case of sepsis. The next question is, does an initial poor ABGA score in the previous baby cause risk to health in the next neonate? Well, not necessarily, because ABGA score just tells how the baby has responded, has presented at 0 minutes, and then at when you assess the baby at 5 minutes and 10 minutes, it tells you how the child has responded to your resuscitation. ABGA score is dependent on a host of factors like gestational age, the maternal history, the maternal drug intake, any congenital malformations in the baby, or any neurological diseases in the baby. So, I mean, if those conditions they recur in the next pregnancy, then yes, I mean, if the same issue has not been addressed, then the original problem or the actual problem which has caused that poor ABGA score persists in the subsequent baby, yes, you can have a poor ABGA score. Like, for example, if the baby has some CNS malformation or some chromosomal abnormality which has resulted in a poor ABGA score, and if that the subsequent baby also has the same problem, he might have a poor ABGA score, otherwise not. Is sepsis in neonates more associated with hypothermia, or do they usually run fever? Well, both of them are common. I mean, it can be, they can present with hypothermia or with fever, but the thing to remember is that the temperature instabilities should be documented, and it's not necessarily that if the child just has fever that you will consider sepsis. The other important thing to remember is that it has been found that hypothermia is probably associated with more morbidity and mortality. And there was an article in JPMA which was published, a study which was done locally, where they found hypothermia to be more common than hyperthermia. Referring to the chart used to measure head circumference, beyond which centile does macrocephaly lie? Well, by definition, according to the AAP guidelines, macrocephaly is defined as a occipital-frontal circumference which is more than 2 standard deviations above the mean or above the 98th percentile. If both subepineuritic hemorrhage and caput succedaneum are not bound by suture lines, then how are they differentiated clinically, and is it necessary that subepineuritic hemorrhage always extend to the face? Well, it is sometimes the both of them can, it would be difficult to differentiate in the sense that they both cross the suture lines, as already been mentioned in the question. But caput succedaneum is more of a benign condition which resolves rapidly, usually within the first 48 hours or so, and it doesn't progress. And on the other hand, the subepineuritic hemorrhage is a more, you would say, the baby is more sick, he is more compromised, and the hemorrhage increases progressively because the subepineuritic space is a potential space, and it has a capacity to hold about 260 ml of blood. So the blood can start collecting in that potential space, and you know that the epicranial epineurosis is attached to the external occipital protuberance posteriorly, and anteriorly it extends to the merges with the soft tissue of the face. So if there is enough collection, the blood, as it increases in size, can extend to the face. The breastfeeding position for cleft palate, well, the position recommended is a modified football position. Unfortunately, I don't have a presentation here or a picture here to show that, but you can get these pictures. You can find them in books as well as on the net, that you do a modified football position in which the baby is tucked under the arm, so that the the legs are behind and the rest of the body is in the front. It's like American soccer, where the soccer players tuck that ball under the arm. But it's a modified football in the sense that the baby is slightly more in the upright position to prevent aspiration. The other position which has been suggested for cleft palate is a rider's position, in which the baby is placed astride on the thigh of the baby, so that he is more or less sitting up, and then he is brought close to the mother, and so baby is fed in a sitting posture. What disorders are neonatal teeth associated with? Now, there's a difference between natal and neonatal, in the sense that the natal teeth, the babies are born with the teeth, but neonatal teeth are usually seen in the first month of life. The exact cause is not known. Maybe it may be because of the superficial positioning of the gum, which may be hereditary. But in some conditions, these teeth are associated, natal teeth are associated with certain syndromes, like Pierre-Robin syndrome, Sotos syndrome, Ellis-Van Creveld syndrome. So these syndromes may sometimes be associated with the natal teeth. Medicines and dosage for oral thrush. You can use nystatin drops for thrush in babies. The dose is about 100,000 international units, which can be given at least 4 times a day for 7 to 10 days. And whenever the baby, newborn at least, has a oral thrush, it's very important to check the mother also, because she might have that thrush on the breast, and it should be concomitantly treated. Size of umbilical hernia. Generally, an umbilical hernia which is less than 1.5 would resolve on its own. So between 1 to 1.5, you would expect that it would may not require surgical intervention, but all hernias which do not resolve have to be followed up, and if there is any evidence that they might strangulate, they should be intervened. Treatment for umbilical granuloma with silver nitrate. Usually 2 to 3 applications may help, sometimes even just 1. The important thing to remember here is that silver nitrate can cause burns, so when it is applied, one has to be careful that only the granuloma is the one where the silver nitrate granules are placed and the surrounding skin is protected, so that they do not cause burns. Is clubfoot associated with other abnormalities? In about 20% of the cases, it may be associated with other abnormalities, and by and large, in 80% of the cases, it is an isolated deformity. The abnormalities which may be associated with clubfoot would be myelomeningocele, arthrogyroposis, congenital myotonic dystrophy, amniotic bands, trisomy 18. So these are some of the other associations of clubfoot. Regarding genitalia ambiguity, how should the parents be counseled if their labia majora are swollen? How long do they take to resolve, and what is the reason of swelling? Well, labia majora swelling is entirely different from genital ambiguity. The reason for swelling could be if there has been a breech presentation and there is a prolonged labor, so there may be some edema and swelling, and that would resolve. It may take a few days to resolve. Genital ambiguity, on the other hand, means when you cannot decide what is the gender of the baby, in which you cannot assign a sex, and the counseling in that regards, as far as genital ambiguity is concerned, well, you have to make sure that the recommendation is that you have to make sure that the parents do not assign a name which is assigned to one particular gender. It should be unisex. They should be careful not to announce the birth, so that relevant investigations can be conducted in order to find out the cause of the ambiguity. of the genital ambiguity, and the treatment can be instituted, and we can do a karyotype or do the relevant investigations. And naturally, it's a gradual process in which the parents have to be told as to what would be the long-term outcome, and that can only be done once we have done the investigations. How long after birth is it normal for a baby to pass urine? Usually, the babies would pass urine in the first 24 hours. Can milieu develop in the postnatal life, or is it necessary for them to be present at birth? In majority of the cases, like 40 to 50% of the time, they are present at birth, but they can also occur later on in life in infancy. Lecture states asphyxia as a cause of jaundice. Kindly explain this with regard to the Apgar score. Well, Apgar score is just an indicator, as I have already mentioned previously. It just tells you what was the condition of the baby at the time of birth, and then at 5 and 10 just tells you, at 5 minutes it tells you, whether your resuscitating efforts have, have done any good or not, and what will be the ultimate outcome. Generally, asphyxia can contribute to jaundice in the sense that hypoxia can suppress the hepatic enzyme, and which cause conjugation of the bilirubin, and whenever there is significant hypoxia, the conjugation of the bilirubin is affected, and you would have higher levels of unconjugated hyperbilirubinemia. Are there any medications taken during pregnancy that are associated with withdrawal vaginal bleed in female babies? No, the definition of withdrawal vaginal bleed means that the maternal hormones, which are at the peak during pregnancy and are transferred to the baby via the placenta, have been cut off at birth, and so the levels of the hormones fall, and that is responsible for withdrawal bleeding. Is it safe to latch babies to mothers who have undergone C-section under general anesthesia in the first hour of life? Yes, it's perfectly safe. That's a recommendation. Can physiological jaundice go on for 2 months, and at what level should we consider it as pathological, and which sunlight is good for physiological jaundice babies, morning or evening? Well, by definition, it's not physiological if it is lasting for 2 months. By definition, physiological jaundice usually starts on the 3rd day after 48 hours. It peaks on the about 5th day, comes down by the 10th to 12th day, it comes down. Usually in term babies, it doesn't go beyond 12 milligrams per deciliter. So any jaundice which appears on first day of life, any jaundice which persists beyond 2 weeks is pathological, and we have to find out the cause. Generally, sunlight is per se is not recommended as a treatment for jaundice. If it is significant, then it requires phototherapy, or you do the needful. What you can do is simply separate the labia out and wash it with water. You do not have to go any deeper. The vaginal secretions just take care of this, and you don't even need to, you just need to separate out the labia and wash it with simple running water. Ointment for eczema in between fingers and toes. It's very unusual to have. Usually you would probably have a fungal infection between fingers and toes. In the pediatric age, usually the eczema in the younger age group is usually on the face and forehead, and as they grow older, it is more and on the extensor surfaces, and in the older children it is more on the flexural surfaces. So it's very uncommon, between fingers and toes. It's not the thing. Probably you mean fungal infection, then you have to treat for that. As far as eczema is concerned in other parts of the body, and if we confirm that it is eczema, the idea is to keep the area moist, because dryness exaggerates eczema. Avoid triggering factors, and you can apply topical steroids. Kindly guide about the teething problems. What advice we need to give parents? I don't know what particular question you have in mind. Generally, whenever the teeth are erupting, children are usually a bit fussy and irritable, and the only advice you can give to the parents is that it will pass off, obviously, and it is and generally the people believe that patient has diarrhea or runny nose, etc. That is per se not associated teething problem. Maybe this is just occurring concomitantly. Teething is common in children obviously, and so is diarrhea and respiratory tract infection, and it can coincide. So that is the only thing we need to say, that it is going to pass off. Generally, it doesn't cause much problem. Mothers can, with a clean finger, can do gentle massage of the gum to provide relief. The cause of subepineuritic hemorrhage and cephalhematoma, it is most likely due to difficult delivery and because of the prolonged bearing down effort of the mother, and when there has been an instrumental delivery like with the vacuum extraction, then you can get subepineuritic hemorrhage or cephalhematomas. What is a premature baby posture on examination? Okay, there is a chart which we use for assessment of gestational age, that is known as the New Ballard scoring system, and it has some physical criteria and some neurological criteria, and if you can get hold of that, you can have a look at it. That one of the criteria for assessment of gestational age is the posture, and it states that the more premature the baby, the more extended his arms and legs are, and as he becomes mature, he assumes a more flexed posture. So depending on the stage of prematurity, he may have a more extended posture, and as he matures, he'll have a more flexed posture. What should be the breastfeeding position in cleft lip babies? Okay, in the cleft lip babies, again, it's very difficult for me to demonstrate in this because it is just question and answer session, and I don't have a picture with me here. But you can, there's a hold known as a dancer's hold, in which the breast is supported by the 3 fingers, and the thumb and the index finger supports the jaw of the baby, and it is approximated to the breast, and it is kept in that position, and the breast is sort of covers the lip to create a seal, and maximum part of the breast is placed at the back of the tongue. Now, the purpose of supporting the breast and the chin is to maintain that position of the baby to the breast, so that the seal is created and it is maintained. According to the lecture, abnormal ears have strong association with renal problem. How is it? Please explain. Well, exact cause is not known. Maybe there is some association at a genetic or molecular level, but I have not found that. But there are associations in the sense that this has been found that whenever there are abnormal ears, there have been renal problems, just like charge associations and bacterial association. They have been found that there are certain things which are common, and you find other things which are associated with that. So the recommendation is that if a baby has any preauricular sinus or pits or any abnormal ears, and in addition to that, if that child has at least one or more of these things, like a family history of deafness, or family history of external ear abnormalities, or a family history of any renal problem, or the baby has any dysmorphism, so any abnormal ears with one or more of these, then they should be screened for renal problem by doing a renal ultrasound. The last question is, distended abdomen on examination is present in which condition? Well, it can be any enlarged viscera, like if there's a gross hepatomegaly or gross splenomegaly, or there's a gaseous distension, or there is intestinal obstruction like ileal atresias or jejunal atresias, or there's Hirschsprung disease or imperforate anus, meconium ileus. So any of these can cause a distended abdomen. I would like to thank the following trainees for their questions, that is Dr. Anam Raza, Dr. Kainaz Shoaib, Dr. Afshan Kawal, and I hope the questions which have been put forward have been clarified, and if there are any further questions, I'm ready to answer them. Thank you.